Right now, I am joined by Dr. Gayle Riley. She is the Vice President of Medical Services at Cherokee Health Systems. Dr. Riley, thank you so much for coming today.
It's delightful to be here. Thanks for having us.
Absolutely, bright and early. So we're here this morning to talk about Cherokee Health Systems and your Get Well Now clinic. So just first off, can you tell us what is Cherokee Health Systems and what do y'all do?
I'd love to. A lot of people don't really understand what Cherokee is. So Cherokee Health Systems has been around since the 1960s. We started out in the behavioral health space doing behavioral health, but pretty quickly added in primary care. So we are a full spectrum primary care healthcare delivery service. We deliver all kinds of care, so primary care, a lot of people know what that is, going to the doctor. We also have integrated behavioral health. So if people need help with some mental health issues along with their primary care, we're right there. We can do those two things together. We have dental services, we have optometry services, we see kids, we see adults, we do women's health care, we have pharmacy services, so we're really comprehensive in the care that we deliver. We are pretty large. We're the largest. We're a federally qualified health center. We like to call ourselves a community health center because we're really all about being rooted in a community and being there for the community. We are the largest community health center, FQHC, in the state of Tennessee. So we cover 13 counties. We have 21 sites and 2 mobile sites. So a lot of space, a lot of people. Last year, we took care of over 66,000 Tennesseans, which we're excited about. We have about 620 employees doing that. And importantly, last year we provided about $11 million in uncompensated care. So really providing care to a large number of people regardless of their ability to pay.
Oh my goodness. So you're in these communities doing a lot of work. As you just mentioned, I mean, that is incredible, the impact that you've had. And there are a few things that make Cherokee Health Systems pretty unique.
Yes. I think probably top of that list is we can see anyone regardless of their ability to pay. And what that means is if somebody doesn't have health insurance, which can be a challenge, we can still see you. And we can see people on a sliding scale. So that means based on family size and income, we can offer you a price for that is reasonable and accessible. We believe that everybody deserves access to good health care. We also, though, see all the insurances. So we see people who are on Medicaid, we see people who are on Medicare, and we see most of the commercial insurances. So we can really see anybody who walks in our door, as we love to say, regardless of their ability to pay.
That is wonderful. And so how can people get involved in the Get Well Now clinic, and then what is that clinic?
Well, that's a great question. So Cherokee's really been in the primary care space up until this point, and as you can tell, we want to meet people where they are. Depending if they don't have a payer source, somebody to pay health insurance, we'll meet them there. We also want to meet them where they are in terms of needing health care. So some people need primary care, they need that provider that they can go to regularly to follow them for conditions. But other people need care at that moment. They may be sick, they may have an issue, and we wanted to also be there for that. So to let people have access to walk-in care when they need it. Lots of care goes to the emergency room that probably doesn't need to be there. So you think about things like an upper respiratory infection, a cold, cough, flu symptoms, a urinary tract infection, diarrhea, vomiting, those kinds of things. Again, they're really not true emergencies. They tie up the emergency room. We would love for people to come to our walk-in clinic and get evaluated and cared for those in the moment. That's why we call it Get Well Now.
Amazing. Well, thank you so much for sharing about that. You can find more information online. Now, we do have to go to break right now, but we appreciate you coming out and sharing with us.
It's been great talking to you. Thank you so much.
Absolutely. More of your top headlines are coming up after the break.